and the early science indicates that Omicron generally causes less severe illness than other versions of COVID-19, but it's still early. We do not understand the long-term impact of this at all. So I don't want people to kind of diminish the dangers that come with the Omicron virus, because we're still filling up our hospitals. People are significantly ill. This is a pandemic amongst the unvaccinated. And the best way to protect yourself, obviously, is to get vaccinated and or get the booster. So we want to avoid a hospital don't have any capacity left, and we're unfortunately the trend is moving in that direction. So we need to stop the trend. So we're facing a real possibility of local hospitals reaching capacity because of the rapid spike. In a moment, Dr. Sarah Moyer is going to provide details on the data we've collected, and she'll also speak with Dr. Mona Lisa Taylor to provide us some insights into what local physicians are dealing with and what they're deeply worried about coming here in the coming weeks we have. As we look around the rest of the world, we can see in some places Omicron has spiked and moved on, but that has a lot to do with people stopping their movement, wearing their mask, getting vaccinated. So there's factors that we can do to make this spike as short as we certainly can. So now's the time for each of us to assess what we're doing to protect ourselves and others from the virus. I want to emphasize the others part. We still have far too many vulnerable people in our community, including elderly people from whom the vaccines aren't quite as effective. We're also seeing more kids get infected as well. So we can all do our part to make sure we're not passing along the virus. So you'll hear me say again, if you're unvaccinated, please make the decision today to get vaccinated. We are seeing new people get vaccinated. Okay, it's not as fast as I'd like for it to see, but folks are saying they've gotten their answers to their questions and they're getting the vaccine for the first time. So know that people are still doing that. We just would like to see more. We've got 100 plus locations across the city, so there's plenty of places for people to get their shots. And if you're eligible for a booster, please get one as soon as you possibly can. The science has shown that the boosters are more effective at preventing illness than the standard regimen behind that. So take a look at this as a way to protect yourself and be strong. The best way to be strong is to get all your shots, including the booster, and then go on the defense. If you feel sick, make sure you're staying away from others. Please wear your mask. If you're interacting with people outside your household, make sure you got a quality mask on. The cloth mask, as we know, just really don't do the job as the more effective mask. And I'm sure Dr. Moyle will remind us about. So the doctors are going to give us more guidance on what we should be doing to reverse the surge in COVID-19 cases. With JCPS opening up here today, that introduces a whole nother variable into the equation as well. So everybody please do their part. And with that, I'll turn it over to our Chief Health Strategist for the city and the Director of our Public Health Wellness Center, Dr. Sarah Moyer. Doc?
Thanks, Mayor. Happy 2022, everyone. Really, thank you for joining the COVID update. I know we met last Wednesday, December 29th, to share with you the rapidly increasing and record-breaking number of cases and positivity rate as the Omicron variant spreads throughout Louisville and the rest of the country. Cases continue to skyrocket, and that is worrisome. We're not trying to instill fear, but I do want people to be realistic. At this rate, it's very likely that our hospitals are going to be in crisis mode, so beyond capacity very soon, meaning critical and elective surgeries may have to be postponed. And if you have COVID or a non-COVID emergency, it might result in delayed care. So joining us later this morning is Dr. Mona Lisa Taylor, who is an internal medicine physician with Norton, and also board chair of the Greater Louisville Medical Society, and she's going to talk about what she's seen firsthand in her primary care office. But first, going to go over the data and going to bring up the dashboard. And so you can see here, we are at 147,449 total cases That is definitely in the red. As of Sunday, we had added 10,000 cases just last week in the short holiday week, putting us at 189.1 cases per 100,000 population. And you could see here in that graph there that huge drastic increase last week. Cases like more than doubling in a week. And as of this morning, we are up to almost 2,000 new cases per day we've added since Sunday, tripling our record-breaking number of cases at 214 cases per 100,000. So expecting this 10,000 to be even higher as we get to Sunday next week. Our death count, as we know, deaths are delayed. We added 16 last week, and those cases spread out over the last few months. Majority of the deaths still in those that are unvaccinated, and as we're reaching more and more people, these are still tending to be younger, and I will go over that data farther down the sheet. So this is our vaccination data. You can see here, even during the holiday week, I know a lot of people are probably waiting to get vaccinated because they didn't want to have some side effects over the holidays. So numbers were down, added less than the previous week for the number of people being boosted, first dose and second dose. You can see here on the website that 62.5% have completed the vaccine series. So that's 2 doses. 72.5% of our population have received at least 1 dose, but only 38.2 have received a booster. And as we know with Omicron, we really want everyone to be boosted if they qualify. And so looking to get that number higher this week, as well as these as well. So as the mayor mentioned, over 100 sites across the community. If you have not been able to get vaccinated yet, please check out vaccines.gov or healthcare systems web pages to get scheduled as soon as possible. Really, that is one of the best protections, along with all the other layers, to keep you safe as we are in the middle of this huge surge. And you can see here still our vaccination rates are not even across the community. So still trying to make sure that everyone has access and is getting vaccinated, and access to education and all the resources they may need. So if you know of anyone who's got questions, please steer them towards some good resources. Let us know what questions you're hearing, and we are happy to answer it. So hospitalizations, as of yesterday, we were at 323 hospitalizations. 11% of the hospitalizations right now are there for COVID. ICU cases at 63 as of yesterday, and 36 on vent. And while these numbers might look not so bad compared to our surge in mid-September, just a reminder that hospitalizations are delayed after the case count. And so with our huge increase in cases these last 2 weeks, we do expect those numbers to go up in the coming weeks. And as you heard from our CMOs last week, majority of the cases are not vaccinated that are having to be in the hospital. So please, while we are seeing some breakthrough cases, or many, as you saw with the numbers, majority of our hospitalizations and ICU cases are in the unvaccinated, especially with the kid cases. Norton Children's yesterday had 16 kids that are hospitalized with COVID, all of them unvaccinated. Majority are in like teenage years. So especially important for all of our kids to get vaccinated, especially our teenagers. And pregnant women, I want to add that on there too. We do have some newborns, young kids, very young kids that are hospitalized, but their parents tended to have not been vaccinated for COVID. And so if you are pregnant, thinking about getting pregnant, please get vaccinated. Please make sure anyone who is around your young children that can't get vaccinated are vaccinated themselves before visiting. So just looking at the ethnicity and racial breakdown of our cases, you can see here that the blue line is the percent of COVID cases. So majority of our cases right now are it is pretty much even population-wise between our white and Black population, but majority of our deaths are in our white population. And this is for many reasons, one being the average life expectancy for a white population in Louisville is higher than our Black population. So not necessarily that this being good news, but a lot of our cases right now that are coming in are in our white population. So this is cases and deaths by age group. All time, you could see majority were in those over the age of 70. And in the past 8 weeks, really since vaccinations have been up and going, we are seeing still younger age groups. So if you are, especially if you're having symptoms or don't know your status, please do not go around any family members or friends who might not be vaccinated that are over the age of 40. Huge risk of hospitalization and death in that population. And then long-term effects in their younger population as well too, and including seeing some deaths in our 15 to 19-year-olds. Almost all of our cases under 70 are unvaccinated, but to keep that in mind as well, I think the hospitals right now, all of the vaccinated are over 80, but just know that if your zip code has a lower life expectancy, then to decrease that number as well as you're trying to protect those around you who may be vaccinated and don't want to get COVID. So the new cases this week have gone up in every age group. You can see especially the 20 to 44 age range, but as well as all age groups, it's going up. And then the last one I wanted to show is the vaccine percent completed vaccine series. And you can see our 70 to 74-year-olds are the most vaccinated in the city. So congrats to that age group. We do have a significant number that are really at high risk for hospitalization and death, over 70 that are not vaccinated. So please try to protect those family members in these coming weeks, as well as anyone you know that is unvaccinated in the other age groups as well too. You could see, unfortunately, only 18% of our 5 to 9-year-olds are fully vaccinated right now, and 41% of our 10 to 14 and 56% of our 15 to 19-year-olds. This is concerning, given that school's back in session now. I know they're doing a lot of great preventative measures with masks and spacing and ventilation and lots of testing, but we still need to try to get those numbers up. I'm going to stop sharing that and say a few more things. So we did release our partners at U of L and Dr. Karimi, who is on our staff, did a study, a projection study looking at vaccination rates in the 5 to 11-year-olds last month. And if we were able to get up to 40% of those 5 to 11-year-olds vaccinated, we would have almost like half the number of adults that end up hospitalized. So really statistically significant number of adult hospitalizations that we can prevent in trying to get those 5 to 11-year-olds vaccinated. So not only are we trying to protect your kids, but we're trying to protect the rest of the community. So please make sure you're getting your kids signed up to get vaccinated. The studies out of the CDC and others really show very few side effects, especially in that age range. It is a lower dose and very safe. So I'm hoping that people sign up to get vaccinated. And as well, so much information to share today. The FDA as well authorized yesterday that you can get a booster for any kid over the age of 12, which can be administered 5 months after their second dose. Usually the FDA makes the authorization and then the CDC has to approve that and make a recommendation. So we're hoping that that'll happen in the next coming days. And so those of you who were over the age of 12 and got fully vaccinated back in the spring can sign up to get a booster shot, hopefully by this weekend. So with that, I'm going to bring in Dr. Taylor now. Dr. Taylor, welcome. Please tell us what you are seeing in clinic right now related to COVID.
Well, hi, Dr. Moyer. Sorry for my tardiness. Our clinic has been very busy, especially with everyone returning following the holidays, given Christmas and New Year's. So we've had a high increase in phone calls and visits to the immediate care centers and testing centers because folks are suffering from these symptoms that are related to COVID. So for my patients that are vaccinated but may have waited on a booster, a lot of them are suffering from some runny nose, sore throat, headaches, and a lot of tiredness. Those have been kind of the main symptoms that we've been seeing. There has also been a cough that's been associated with this. And those are the folks that have come back positive for COVID. For folks that may have not been vaccinated, a lot more of those folks are suffering from shortness of breath, worsening of that cough, more significant issues with their breathing. So really important for all of us to get vaccinated and to get that booster if you're 6 months out from that second dose of the vaccine. So that way you have better coverage against this particular variant that we're seeing so highly in our community.
Thank you. So you did mention you're seeing a lot of breakthrough cases in your practice. Sounds like the symptoms tend to be more mild. Are you hearing any like barriers or reasons why people are delaying getting that booster, and any advice that you're giving to your patients to get them to either sign up for that first dose and to get that booster? If you could talk through that, as well as maybe some
Sure.
questions you're getting on why people maybe haven't signed up yet.
I know a lot of my patients in particular waited until kind of that Christmas holiday if they were teachers, because they wanted to make sure they had some time off in case they did have some side effects from the booster. Those symptoms following a booster dose of the vaccination are mild. So I would highly encourage everyone to go out and get that third dose of the vaccine if it's been 6 months since your last dose of the vaccine itself. Another issue that kind of caused some confusion is folks who previously had a COVID infection. Maybe you got sick with Delta back in August or September or October. Those folks that may have gotten sick with COVID previously, you only have to wait 14 days to get that booster dose. Now, if you did get hospitalized or you got monoclonal antibodies like the Regeneron product or one of the other infusions that are available, if you are in that category that you had the infection and got one of those monoclonal antibodies, you'd have to wait 90 days before you can get your first dose or your booster dose of a vaccine. So I know that piece has caused some confusion, so I just wanted to clarify that.
No, I appreciate that. And we're seeing, we talked through a little bit different of the treatments now with Omicron versus Delta. Can you talk through maybe who you're qualifying to get some of the monoclonal antibodies and what wait times are and what people can expect with that right now?
Wait, okay, great question. Lots of phone calls on this too. Wait times for monoclonal antibodies have been really long. It's taking a couple of days because there are so many people who are getting sick, and unfortunately, our supply is very limited. Against the Omicron variant, we only have one monoclonal antibody that does seem to be more helpful against this particular version of the virus. So that's further limited our supply. So for my patients who may be older, may have more chronic medical conditions like diabetes, breathing issues, heart issues, they're immunocompromised because they might have rheumatoid arthritis or a cancer. Those are the folks that are going to be higher on that list in order to get the monoclonal antibodies. So it's going to be very limited at the moment as to who can get those types of therapies, unfortunately.
Yeah, I mean, huge drastic decrease in numbers that we have available this week compared to previous weeks, as well as a huge number of cases too. And so unless you, as you said, are like severely immune compromised and having symptoms, there's only a couple hundred doses just for the entire community for the week. And so they're getting saved for that. Let me see, any other advice you want to give the public or questions you are hearing or seeing?
Well, in regards to treatment, I'm going to add, I know we've seen a lot of information out there about the Pfizer product and the Merck product, which are the tablets. They sound very promising, but they are not available in our community just yet. And I know we're only going to be getting a certain allotment for the state. Dr. Moyer, you can correct me if I'm wrong there. But we have not seen those just yet. So hopefully coming down the pipeline. In regards to other advice, I would highly recommend wearing a mask, particularly if you're in public spaces right now, because you don't know what anyone else has been exposed to. So wearing a mask just to give you a layer of protection and the others around you is going to be so important. This also includes getting vaccinated, which is going to give your body an opportunity to help you fight off this infection, which has become so important. My folks that are vaccinated and have received that third dose of the vaccine, they're having these milder symptoms from COVID infection right now. And that makes it so important to get vaccinated.
Well, let me do the best I can. I'm her daughter-in-law, not her daughter, so I don't know
Karen,
if I'll
can
know
you
everything.
mute your,
It's just
Karen, can you
basic.
mute, please?
If she gives permission to release information to anyone, we would just
Hey,
need
guys.
that marked and the names.
Okay.
Okay. So getting vaccinated is going to be really important. So if you haven't gotten your first dose of the vaccine, I would highly encourage you to go and get that today. And like I said, if you have already received 2 doses of the vaccine and you have yet to get a booster, please go get a booster just so your body has as much protection as possible to help you fight off this infection. Those would be the main things that I would suggest at the moment.
Thanks, Dr. Taylor. Just want to add as well that it does take like probably at least 2 weeks, and max protection is about a month after you get your vaccine. And so please don't think you have extra superpowers the day after you get it. You still need to be extra cautious until that your body is able to make those antibodies. So sign up today, still be cautious until you have some extra immunity there. One question we were getting a lot of the last couple weeks was flu. Have you been seeing any flu cases in your office this last week?
So much. Flu is definitely back, y'all. It's making its own little comeback. We're seeing a lot of folks that are getting sick with the flu, but even other cold viruses, which we are also seeing. So the way to help differentiate, do I have the flu versus is it COVID? Flu symptoms tend to present really quickly after you've been exposed, probably within 1 to 3 days. You're going to have higher fevers, you're going to have the muscle aches, a lot of cough, congestion, and potentially some shortness of breath and discomfort in your lungs. And so flu is out there as well. So that also makes wearing a mask so important because it's going to help you prevent these other infections because all the viruses are circulating and in the air. So wearing that mask is going to help you prevent those other infections as well, and making sure we're taking the good precautions that we've been talking about, the physical distancing, making sure we're washing our hands. Those things will help us prevent these other infections that are out there. Because I can tell you, if you do get sick with the flu or with COVID or with anything else, our clinic appointments are very full. Our ICCs, our immediate care centers, have a very long wait at the moment. And if you have to go to the hospital, you may be waiting for quite some time because there are so many people getting sick with not just these respiratory illnesses, but then all the other things that we see in January, since these are the busiest times of the month or of the year, excuse me, to get sick with something and to be seeking out care. So anything you can do to help prevent those things from happening, it's going to be for your benefit.
Thank you for that reminder. And I think just making sure people are also aware that if you're catching flu and other viruses, you're really putting yourself at risk for COVID because COVID spreads much faster. And so if you were doing something that you caught another virus, it's just a good indication that you need to up your spacing and masking games and making sure any appointments you have that can be virtual, any people that you could see virtually instead of in person right now, now is the time to make those changes. So with that, I believe the mayor had to jump off for another press briefing. The state had released new CDC or new state guidelines based off the new CDC guidelines. And so Catalina, if you don't mind bringing those up, and I will go over those quickly as well, just to make sure everyone locally is aware of the new quarantine and isolation guidance. If you don't mind putting up the other one, the 10-5-10 is a little bit easier to see. Thank you. So instead of 10-10-10, we are now 10-5-10. So if you've tested positive for COVID and have any symptoms, you still need to isolate for 10 days since those symptoms start. So it's still 10 days if you have symptoms with your COVID infection. If you're just getting screened for work and it was asymptomatic, or even maybe if you if you never had symptoms and were getting tested for some other reason, close contact, we can now isolate for 5 days from the date you had your tests done. The big thing with this is that you have to wear a mask for 5 additional days after that, and that is a must. That mask wearing is a must, even if you never had symptoms. So because of this, a lot of high-risk situations like our daycares and schools and other nursing homes and other healthcare facilities have different rules as well too. Those rules haven't changed yet, and so it's still 10 days for those people, assuming nothing changes with crisis situations coming here forwards. But again, if no symptoms, you can do 5 days, but you have to wear that mask. And then if you're not fully vaccinated or booster, or been boosted in the last 6 months, you do have to quarantine for 10 days as well from your last exposure. It can be shortened to 5 days if you have no symptoms and test negative for COVID on day 5. But you still have to wear that mask for that full 10 days after you've been around somebody with COVID. This is slightly different because previously, if you were fully vaccinated, even if that was a year ago, you were allowed to not be in quarantine with a mask on. So now you had to have had that booster or had gotten your vaccine in the last 6 months if you got Pfizer or Moderna, and 2 for J&J in order to qualify for this, in order to not have to quarantine with a close contact. So 10 days unless you've had your booster or recently vaccinated, and you have to wear your mask if you do test out on day 5. All right, I'm going to pause there. Dr. Taylor, I don't know if there's anything there you wanted to clarify, make sure that I said clearly. I know it's really confusing, but so much changes as we learn more about the virus. I just want to make sure everyone is aware.
And I think just to reemphasize, the folks that are asymptomatic, that means you've tested positive for COVID and you don't have any symptoms. Those are the folks that need to isolate for 5 days. And then for the next 5 days, really, really important to wear that mask, because that's going to help you prevent spreading that infection. So those 5 days of mask wearing, please make sure you're wearing your mask correctly, so that way you can help prevent the spread to others around you, most importantly. So just wanted to reemphasize that. And of course, 10 days, if you do have symptoms, 10 days of isolation while you have those symptoms. So that way, again, you can help prevent that spread of this virus to your loved ones and your friends.
Well, thank you, Dr. Taylor. I think just in closing, before we go to questions, thank you everyone for being interested in testing. It's really important. Just have patience as lines tend to be longer. Don't run out and get a test that day that you're exposed. Please wait till that day 5. We don't want you to think you are clear and not really yet. So that'll help with the wait as well too. I think I see a question in the chat box about wait time being 2 to 3 days. That is fine. Just make sure you are staying home until you get that test. We are also seeing like test positivity, especially in those that are vaccinated, take a couple days to test positive. So it's probably better to wait those 3 days anyways, as long as you could stay home and safely isolate. One more big plug for our helpline. The number of calls have doubled just in the last week. So as well, again, please patient with that as everything else. But please call us with any questions, 502-912-8598. Again, we are not doing overall contact tracing like we were in May of 2020. So please let your close contacts know if you expose them and tested positive or think you might have COVID. As well as any places that you have been in the community. But we are there for questions and can help give you advice, help you talk through that, as well as help schedule vaccination appointments, testing appointments, telling you where to go. So 912-8598. And then we also do still have room in our isolation hotel. And so if you can't safely quarantine at home or isolate at home, please let us know and we will get you set up with that as well too. Or if there's any needs that you need to get delivered to your house, whether it's medicines or food, or even things like diapers to stay home during that isolation and quarantine period, please call and let us know and we can help you with those as well. So thank you, everyone. I know we all want to be done with COVID. We all want to be done wearing masks, but now is not the time for that. So thank you for all the business out there that are requiring masks on entry. It is making a difference. Definitely recommend that if you want to keep your employees and customers safe, as well as vaccination as well too. Workplaces that have higher vaccination rates are seeing less disruption to service and their business. So both of those are very important pieces. Wish you luck as we start 2022, and I will turn it over to Kathy to go through the questions.
Okay, thanks, Dr. Moyer, Dr. Taylor. I'm going to reiterate Lexi Ratterman with WDRB, her first question, which was, as cases spike, are there concerns? Do either of you have concerns with difficulty to find a day of test? Because most sites are booked 2 to 3 days out. What's most important here? Dr. Taylor?
Great question. I know everyone's trying to get out and get a test. I would make sure that you are waiting a couple days after your exposure. So let's say I got exposed today. I want to wait about 4 to 5 days to get that test done, so that way I can see if I have COVID or not. So that means I would be looking at something on Saturday or Sunday on the weekend. So trying to plan that out might be worth it. I know sometimes that's harder to do in terms of planning purposes, but if someone calls you and tells you that you've been exposed, that may be a good way to get an appointment for a test. I know there's a lot of home tests that are also available, but they have quickly gone off the shelves. If you are having symptoms and aren't feeling well, please call your primary care provider, or you can also seek out care at an immediate care center. Like I said, it will be a wait, but you would be able to get a test in sooner.
Thank
And
you.
we also have sites on our website as well too that don't take appointments and are available for drive-through, so you might have to wait. So I know at least all the Blue Water sites are non-appointment, and so you can drive up there same day if you happen to get symptoms and feel really sick and need to know, as well as if you're a JCPS student or staff member, their sites well, you have to register, but tend to not be booking up. You might have to wait, but there are still availability on the same day if needed. Because like Dr. Taylor keeps mentioning, the wait time in our physicians' offices is really long right now. And so if you don't feel sick enough to have to go in for that, best to try to find a test, and then just stay home. That is the most important piece. Wear your mask and stay home, protect your family members and your coworkers.
Thank you. Another question from Lexi Ratterman with WDRB. Dr. Moyer, are we seeing breakthrough COVID cases rise rapidly as well?
Yes, we are. We're seeing more breakthrough cases with Omicron. It is much more contagious than previous strands. And as FDA and CDC, as you see, they're changing guidelines, really recommending that booster. And so even those people that are fully vaccinated are still at risk unless they had the booster. We are occasionally seeing those booster breakthrough cases, but people tend to be milder, being able to stay home with those symptoms. So you might feel like you have a mild cold, but still really important to get that booster.
Thank you. And a related question to that we got from social media, and we get this occasionally on social media, is if you can still get COVID, even if you're vaccinated, why bother getting vaccinated? Dr. Taylor, would you like to answer that
Yeah.
or add to
Yeah.
that?
I've been addressing this with a lot of my patients in the office too. And I know it's hard to decipher through all the information, and there's so much information out there. The vaccine gives your body a framework on how to fight off this virus. And you may still get sick because this virus is slightly modifying itself. It's changing, it's smart. And so it's trying to get smarter. And that means that our body is going to recognize it and going to try to fight it off too. But in some cases, we may still get sick because of the way this virus has changed. Now, if you're vaccinated, you're going to be more likely to have milder symptoms, more upper respiratory, more sinus issues. Those are the type of symptoms you're going to have if you're vaccinated. You're less likely to have the breathing issues, and most importantly, you're less likely to have these prolonged COVID symptoms. Because I can't tell you the number of people that I have seen, especially in the recent weeks, who have had continued difficulty with their breathing. I have one lady who's still on oxygen right now from an infection that she had in September and October. I have another gentleman who unfortunately had to go to the hospital for COVID and still has the pneumonia in his lungs. It's still hanging out. And that is something that your body could help you fight off if you've gotten the vaccine. So that way you won't have these prolonged symptoms. I know we all want to get back to work. I know we all want to get back to events and things with our friends, and getting the vaccine will help get us closer to that and help make sure that COVID's a mild illness for you and that you don't have these prolonged symptoms that could affect your breathing or affect your energy levels, that could impact you from being able to do those things that you love.
Thank you, Dr. Taylor. This next question is from Sarah Ladd at the Courier-Journal. Dr. Moyer, what's the current positivity rate in Louisville, Jefferson County?
We are at a record-breaking 27%. So it keeps going up. So we know not enough. We're not catching all the cases that are out there. And so just another reminder, if you've got symptoms, stay home, get tested. We want to make sure everyone has access to the treatment if they qualify, access to resources. So please get tested if you've got symptoms. If you can't find a test quickly, just stay home until you can.
Thank you. Another question from Sarah is, Dr. Moyer, based on what you know about mask usage, vaccine percentages, and when Omicron got here, when do you expect Louisville to peak?
That is a really great question. And I think it all depends on what we all do in the next coming weeks. If we can slow down our movement and our interactions, that peak's going to take longer to get to and longer to get out of, but it will keep our case counts maybe not going up so high. If we keep doing what we've always been doing, the numbers are going to keep going up really quickly and probably back down in 3 to 4 weeks. So we'll see what happens, what we decide to do as a community, but I'm hoping to flatten that curve a little bit so our healthcare system is able to help those that need it.
Okay, this question is from Brooke Hash with WHAS. We're hearing from other cities and health departments about the lack of help and response they're getting from state and federal agencies trying to get more at-home tests available. Are we seeing the same issues in Louisville? Dr. Moyer, can you answer that?
Yeah, so there's a much greater demand for at-home tests than there is supply. I know every time a store has them in stock, I think they go off the shelves very, very quickly, the same as online. So definitely an issue. I think we've got a good amount of testing supply here in the community and more capacity, especially to some of the drive-through sites. And we'll see more drive-through sites opening up as our numbers of people wanting tests continues to increase here in the next couple of weeks. So those are available. But if you want to just be testing at home every day for the fun of it, there is definitely not supply for that right now.
Okay, thank you. This next question is from Bria Jones with WFPL. She is saying that they know of a shortage of workers at MSD. Are some services temporarily suspended? Does it seem like other city departments are experiencing the same workplace shortages? Dr. Moyer, I know you can really only speak to public health and wellness, and I'm happy to follow up with Bria on this question afterwards, but are we experiencing workplace shortages with the health department?
I think every business in the community has people out. I've seen everything from yard waste getting delayed. I did not hear about MSD yet, but I think, as I mentioned a couple weeks ago, I think every workplace need to prepare for entire shifts of people being out. I know our healthcare system is seeing shortages in their staff being out, which is putting a strain on the number of people they're able to admit and take care of. We're seeing our testing sites having staff being out due to COVID as well too, and so just less people in general happening just because people are out sick right now.
Thank you. And Bria, I will check with the mayor's office to see if we have any other challenges, and I'll follow up with you after the briefing. And then a final question from Bria at WFPL is, with JCPS students returning to class today, are there any concerns about spread through the schools? Dr. Moyer, can you answer that?
Sure. I mean, I think anytime people are close together, there is concern about spread. JCPS fortunately still has their universal mask mandate in place. They are still doing very frequent testing, screening anybody who wants to weekly, as well as anybody with symptoms. They have a very high vaccination rate in their staff. And so I think they've done everything that they can in order to make it a safe place. I'm much less worried about our students being in class over these next weeks than I was about our students in gatherings over the last month. So I'm hoping that all the COVID protections do work, and hopefully maybe even stop some of the spread that's happening due to the gatherings that happened the last 2 weeks, and then parties and concerts and other things that happened in December that led to a high number of cases.
That was our last question. So before we close, do either of you want to share some last thoughts? Dr. Taylor, I'll start with you.
I highly encourage all of you again to just stay as healthy as possible. Please continue to do those good things that we have gotten used to, of doing the physical distancing, washing your hands, wearing a mask, and getting vaccinated, because getting vaccinated is going to be the best way to give your body an ability to help you fight off this infection and make sure it's just something mild. If you have not gotten boosted, please get that third dose of the vaccine if you do qualify and it's been 6 months out from that second dose of the vaccine. So please, please, please stay healthy, everyone. I hope we don't have to see you in the office or at one of the immediate care centers or in the ER, but we're here to take care of you if you do.
Thank you. Dr. Moyer, any final thoughts?
I think that was a beautiful way to end it. Just hoping everyone can stay safe. Please try to limit your activities these next couple of weeks. Get vaccinated, wear your mask, make sure you're in places with good ventilation, and we can get through this, and hoping for better numbers in a couple of weeks.
Thank you. Thank you both. Thank you, Dr. Taylor, for being our guest. That's the end of our briefing. Thanks, everyone, for joining us.